thank you for everybody that presented. It was such an incredible presentation, and I was so taken in and writing down so many notes. But we have a lot of work to do, so I want to really move on to our next session. And this is one of the key priority areas that we talk about: climate change. We talk about extreme weather. We talk about equity in the process of it, and it's important that we are able to talk about an issue that is happening in our communities, that is really affecting our communities, and making sure that we can have time for it. The administration has prioritized this issue across all populations as included in the scope of the work of the Commission and the initiative. Understanding extreme weather, climate change, and environmental risks that affect and impact AA NHPI communities is critically important to the survival and long-term health of our communities. So today we have Dr. John Balbus, who is HHS's Director of the Office of Climate Change and Health Equity, and he's going to share a bit more about the risks and the impact on our communities. And he's also a physician and has served as HHS principal to the global U.S. Global Change Research Program and co-chair of the Working Group on Climate Change and Human Health for the U.S. Global Change Research Program. So with that, Dr. Balbus, thank you for your patience and thank you for joining us today. We're really looking forward to your presentation.
Well, thank you so much, Commissioner Shaw. And let me just start off by saying what a privilege it was to be part of that or be able to listen into that conversation in the last 20 minutes. It's a sensitive conversation. It is really uplifting to see the Commission taking on the healing process that we really need to be showing from years, from decades, really from centuries of this kind of traumatic activity. And it's in that context that I come to you today, a context of humility and, wanting to be part of that solution, with the lens of addressing the layering on of stress, the layering on of risk that's coming with climate change. So with that, could I have the next slide? And what I'm going to try to do in hopefully around 20 minutes is to give you a quick overview of how climate change impacts health, why it needs to be viewed through a health equity lens, and some of the unique impacts that we've seen on the Asian American and Native Hawaiian and Pacific Islander communities. And then I'll close by talking about the office that I've been asked to come over and help start up, and the solution space that we have. And I just wanted to share this quote from your co-chair of the Commission, Secretary Becerra, who is a very strong supporter of this issue, that the time is now, right? That this is the issue of climate change is punctuating the issues we have of racism in this country, blending and combining to really affect people's lives in a very profound way. And the time is now to take those actions to protect our world and to address the twin threats that we're talking about today. So next slide, please. I'm going to start by talking about just what happened this last summer as an example of how these factors come together. And Hurricane Ida slammed into the Louisiana coast in late August of this year as a Category 4 hurricane. And I'm showing its path because wherever that path was, there are communities at risk. There are communities at risk for reasons that people just live in different places, but there's also communities at risk because of forces of racism that have created neighborhoods or created the conditions that people live in, communities of color, communities of Asian Americans, Native Hawaiians, Pacific Islanders, that are related to the topic that we just had. So in striking the coastal Louisiana, that's an area where there are many people of Vietnamese origin who are commercial fishermen, and there was devastating impacts there on a community located there, in fact, for economic opportunity, but nonetheless in harm's way in that way. The storm, of course, crossed the United States and in a very unusual and, fueled by the amount of water that the atmosphere holds now because associated with climate change, caused unprecedented flooding in the metropolitan New York area, northern New Jersey, New York City, and as the headline shows here, devastated communities and lives with a disproportionate impact on Asian Americans who, for reasons related to structural racism and the way we've segregated communities within the cities in the United States, were put in harm's way when the floodwaters came because they were living in basement apartments and buildings that were more vulnerable. Next slide, please. This is just one example of disasters that are exacerbated by climate change. Of course, 2021 was a bad year for the country. And this is just a map that came out recently from NOAA showing the distribution of climate, of weather-related disasters. And many of these, such as the droughts, the heat dome, which actually wasn't a disaster, but was a devastating impact in the West. The multiple hurricanes striking nearly the same place on the coast in the Gulf, and the extremes of weather, hurricanes, tornadoes in very unusual times, sometimes striking in December, sometimes striking out of the usual period. Wherever these disasters are occurring, there are people who are more at risk, again, because of structural forces that expose them to the hazards and deprive them of the same kind of infrastructure investments, the same kind of housing protections, et cetera, to be able to protect them. And a lot of this, of course, is tied with poverty, but there are other factors as well. Next slide, please. And 2021 was a bad year, but as you can see, the years have been getting bad. Over the last 5 years have been some of the most severe years for this country in terms of the number of devastating billion-dollar events. And just to the next slide, back to where this occurs, just so that we can see that these events are occurring. Not every event can occur everywhere, but certainly, we have the Gulf being hit by the hurricanes, the West by the wildfires, droughts, and severe floods and mudslides. Center of the country is at greatest risk for the extreme thunderstorms and tornado events, and then we had the flooding event that didn't quite make it on the map, but it's down there as Hurricane Ida below. And the next slide, please, just to reinforce the fact that that people of Asian descent are in harm's way almost no matter where these events are occurring. So there are communities in the upper central states and right into Tornado Alley, and of course the communities. There are many communities that are concentrated in the urban areas of our cities, which puts people in a special category of vulnerability to specific kinds of risks. So the next slide, please. Of course, disasters are one way to be thinking about climate change, and it's what gets in the news. It's what we hear about the most. But this is a slide that comes from my colleague, George Luber at the CDC, that is a way of thinking about the public health impacts of climate change in a more holistic way and reinforces the point that there are many different ways that climate change is impacting our health. The center ring there is showing the primary manifestations of climate change, either more extreme weather, heavier precipitation events, rising sea levels, rising temperatures globally, and increasing carbon dioxide levels themselves which have their own impacts on our ecosystems and our health. And then the next ring out are back to the slide before. The next ring out are what we think of as the pathways. So some of the pathways are pretty clear, the heat waves, the severe weather. Some of them relate to changes in our ecosystems, which lead to changes in where we see ticks or the kinds of mosquitoes that carry diseases like dengue or malaria. Or we're also seeing changes in the pollen seasons, more intense peaks in the pollen, and carbon dioxide may actually change the allergenic nature of some pollens. And then in the bottom left there, quadrants are things that are more about the displacement of people, more about profound, almost existential threats to water and food supplies, sea level rise making land unable to be cultivated because of salination or salinating the water supplies. And of course, these are impacts that are most devastating in low-lying island states, which is where a lot of the populations we're talking about now either are living now in the U.S. territories or have had to migrate from and maybe have family back in those locations. So it's, again, a wide range of impacts that affect different populations in different places, depending on what are some of the more prevalent health disparities affecting those populations, or just where people are located, where they might be in harm's way. Next slide, please. And the next slide gets at this intersection of the social determinants and how people end up having worse impacts from climate change related threats. I won't go through this in detail because of time, but on the left side there, you see the way we think about the factors that make people more vulnerable. It could be because they are in a place where they're more exposed, or their job makes them more exposed because they're outdoor workers, for example. And that leads to people being more exposed. But there's also the interaction between underlying health disparities. So populations that are experiencing higher rates of asthma, obesity, diabetes, heart disease, depression, anxiety, all of the health disparities that we see that were so devastating to people when faced with the COVID pandemic are exactly the same kinds of health conditions that make people more vulnerable to heat waves, to being in an extreme event, to being exposed to wildfire smoke, et cetera. And so one of the key things that we talk about in our office to address the vulnerabilities of specific populations to climate impacts, or on the flip side, to making people more resilient, is doing everything we can to chip away at the health disparities, to work at those fundamental social determinants of health, to reduce the rates of those chronic conditions so that people's health is not quite as impacted when faced with a heat wave or an extreme event. And then lastly, the space between people being impacted and exposed and actually having bad outcomes has to do with many of the social determinants related to